So the vestibular system is one of our three main balance systems, but it's tiny. It sits deep to the eardrum, so deep in the ear canal. It's about the size of a thumbnail, and it can be involved in both hearing and telling your body where your head's at in space. So a vestibular disorder can present in a couple different ways. Probably the most common is vertigo, or BPPV, which you may have heard from your doctors before. That has to deal with room spinning sensations. So often when you turn your head or get up from bed, when it feels like the entire room around you is spinning. It could also be just general sense of feeling off balance, not quite right, maybe a little foggy or fuzzy. We don't always know the cause. Sometimes it's linked to dehydration, sometimes it's linked to low levels of vitamin D, and sometimes it happens seemingly out of nowhere. Any type of head traumas can also jostle the vestibular system, so anything that can kind of dislodge those crystals in the ear. So that might be a motor vehicle accident or a hard fall, anything like that that can throw off your sense of equilibrium. If it's a true positional vertigo and we're able to correctly diagnose and identify the involved canal, it can be as quick as 1 to 2 visits with resolvement of symptoms. But if it's more related to the two systems, the one in the right ear and the one in the left ear, not working together, that can take a little bit more repetition. So that might be a full plan of care in 4 to 6 weeks. So once you've had a vestibular symptom disorder, it can return. So you're at a higher risk factor for it returning. However, you're also equipped with the knowledge of knowing how to identify it faster, how to potentially resolve it on your own, and or how to get in to see us if needed. No, you don't need a physician's referral or diagnosis to come and see physical therapy for any type of symptoms related to dizziness, imbalance, or that room spinning vertigo we talked about. A vestibular trained physical therapist is highly qualified to evaluate and immediately start treating, so that defers any delay that you might have in starting to get to your recovery.